Hartford HealthCare is the first healthcare organization in the state to take the COVID vaccine on the road, delivering the vaccine to homebound patients in Connecticut. Joining us to talk about this program is Andrea Griffith. She's Vice President of Operations at Hartford HealthCare at Home. Thanks for being with us.
Thank you for having me.
So tell us about Hartford HealthCare's program to vaccinate homebound patients. How does it work?
Sure. So Hartford HealthCare at Home introduced a homebound vaccination program, and we're very excited to be able to support this very vulnerable community. We basically took time to identify all of our homebound patients that were on census with us, reached out to them, engaged them around their need for a vaccination, and really engaged them to confirm that they, in fact, were receptive to receiving the vaccine. Once we identified all the patients that we could potentially vaccinate in the Hartford region, that's where we started, we basically just started to mobilize a team to go out and vaccinate. Very excited to report that most of our homebound patients are very receptive, keeping in mind that this is a vulnerable community and that they are unable to make it to any vaccination site or clinic. And so we're, in fact, taking the vaccine to them.
So you aren't doing this alone. Tell us about the collaboration with other home care organizations and the state.
Absolutely. So as we all know, there's multiple health systems and home care organizations that are interested in supporting these very vulnerable patients. And Hartford HealthCare at Home has historically partnered with Department of Public Health and other home care organizations to support basically introducing the same program. And so really just we've been the first to introduce it, and so being able to introduce best practice, share things that we've learned as a result of introducing the program so that other home care organizations can do the same.
Nice. So what is the point of the program?
So really the value or the point of the program is these patients, again, they're our grandmothers, they're our great-grandmothers, our elder community. These patients are homebound, which means they are unable to make it to a vaccination site. They may have significant mobility challenges or have multiple comorbidities which inhibit them from leaving their home. So if you think about just the risk or being vulnerable to contracting COVID-19, instead of them going out of the home, we are in fact going to them.
All right. And final question, how can people reach out and get in touch with you?
So Hartford HealthCare at Home, we have a 800 number, 1-800-HOME-CARE. If there's patients that are on our census that are interested in receiving the vaccine, they can call that number. We're across the state of Connecticut. We have 5 regions. We've started the vaccination program in Hartford. However, we will scale to every region, including our East region, Fairfield, Northwest, as well as Central and East. So over the next several weeks and months, we will support all of our regions, supporting the entire state of Connecticut.
Hartford HealthCare is everywhere in Connecticut. All right, Andrea Griffith, thank you so much.
You're welcome. Thank you for having me.